Hello friends, welcome to my YouTube channel Guru Ramdas Educational Society. This channel is intended to provide information on Mudra Science, Reiki Techniques, Gurbani healing and medical education. I am Dr. Jagjeet Singh and I am going to share a topic about heart attack. Now, what is heart attack? Heart attack is a condition where there is a decreased blood flow to the muscles of the heart. It is due to the blockage in the coronary artery, and there is a decreased delivery of oxygen to the heart muscle. As a result of it, the heart cannot pump blood and it is leading to heart attack. Now, talking about the symptoms of heart attack, what are the main symptoms of heart attack? The first most symptom of heart attack is chest pain. There will be pain in the chest, and this pain will radiate to left arm or left shoulder. In women, it can be seen in area of neck, jaw, back, upper abdomen, right arm, right shoulders, etc. So pain localization of heart attack is given by Levin's sign. It is a clenched fist that localizes the pain over the sternum. Now, already we know that many people all over the world get sudden heart attacks. It can be due to any underlying comorbidity. The pain in heart attack can also be associated with nausea, vomiting. There can be abnormalities in heart rate and blood pressure. Suppose if there is an abnormality of heart rate and blood pressure, it can be due to excess of catecholamines which are released from sympathetic autonomic nervous system. Now, talking about the mechanism of heart attack, what is the main mechanism of heart attack? Over decades, there is a formation of a plaque which is known as atherosclerotic plaque. That plaque forms within the coronary artery, and the plaque formation is made up of two components. The first component is a peripheral cap, which is made of fibrous tissue, and the central component is made of foam cells, which are basically macrophages, phagocytosed cholesterol. Now, when there is a plaque formation within the coronary artery, it will restrict the blood flow to move to the heart. There will be hypoxia within the tissues, and that can lead to partial blockage, and that can lead to symptoms of chest pain, nausea, vomiting, dizziness, loss of appetite, loss of consciousness, etc. The story doesn't end here. After the formation of a plaque, there is a rupture of that plaque, and when that plaque gets ruptured, it leads to a thrombus formation. There is a formation of a thrombus within the coronary artery, and that results in heart attack. Heart attacks can be silent. In 24% to 64% of people, there is silent heart attack. Now understand, what does it mean, silent heart attack? Silent heart attack means there can be an absence of symptoms. There will be no symptoms of heart attack. Neither there will be any chest pain, neither there will be any nausea, neither vomiting. Any of these symptoms would not appear, but still there can be a sudden onset of heart attack. Silent MIs can be more common in diabetics. So diabetics who have glucose level above 500 mg per dl, who do not control their glucose by taking anti-diabetic drugs, they can be prone to silent myocardial infarctions or silent heart attack. In heart transplant patients who are undergoing heart transplant surgery, they can also have heart attacks. Now, suppose the donor heart is transplanted into the recipient chest. The nervous system of the recipient is not innervated by on the donor heart, and that will lead to silent heart attack. Now, the type of necrosis that is seen in heart attack patients on gross pathology is coagulative necrosis. So, if we examine the patient, if we take the histological specimen and if we see what kind of tissue is present, we can know that it is a type of coagulative necrosis. Homocysteine levels can also result in blockages within the coronary artery, within the artery of the heart, and that can also lead to heart attacks. There are genes that are associated with heart attack. There are many different kinds of genes, namely 27 kinds of genes are associated with heart attack. Some of them are ADAM gene, PCSK9 gene, SORT1 gene, factor 1 gene, etc. These are associated with heart attack. And there is the most common, strongest association of heart attack with chromosome 9. So, chromosome 9 is responsible for causing familial type of recurrent heart attacks. Heart attacks based on ECG can be classified into two types: STEMI heart attack and non-STEMI heart attack. Now, what does it mean, STEMI heart attack? STEMI heart attack means that there is an ST elevation in V1 and V2 leads, which will be more than 2 millimeter in males, and in females it will be more than 1.5 millimeter. And this kind of heart attacks are seen in 3 million of people. So 3 million people get affected with ST elevation heart attacks. There are also non-ST elevation heart attacks. Now, what does it mean, non-ST elevation heart attack? The name suggests that there is no ST elevation on ECG, but still there is a heart attack, and that is known as non-ST elevation heart attacks. Suppose, in comparison to relatives, if there is a first degree relative, for example, male first degree relative like brother and father, whose age is below 55 years of age, suppose he is 35 years of age, then he can have a strong predisposition for transmitting the genes into their offsprings, and this can lead to familial kinds of heart attacks. In females also, if there are first degree relatives like mother and daughter, they can also transmit genes related to heart attack into their offsprings, and that can also result into familial type of heart attacks. Now, talking about genes and relatives, I would like to talk about types of heart attack. What are the different kinds of heart attack based on consensus in 2012? So there was a classification. It showed that there can be spontaneous heart attacks due to ischemia, heart attacks due to coronary angioplasty, and heart attacks due to coronary dissection. Now, in stepwise manner, we will discuss all the three categories of heart attack. In spontaneous type of heart attacks, what is happening is there is a rupture of the plaque, as I told that in mechanism. When there is a rupture of the plaque, that will lead to heart attack. So those are spontaneous heart attacks. Coming to the next category of heart attack, that is heart attacks due to ischemia. If there is a blockage within the coronary artery, it can be due to coronary embolus, coronary thrombus, anemia, arrhythmia. So these conditions can also lead to heart attacks. Now, third category, that is heart attacks due to coronary angioplasty. If there is a failure of PCI procedure, percutaneous coronary intervention procedure, and if there is a failure of CABG, coronary artery bypass graft, and if there is stent thrombosis, if there is a thrombosis induced by stent, so that can also lead to blockage within the coronary artery, and that can also lead to heart attacks. Coronary dissection can also lead to heart attacks, and this is more common in women. There is a fact that I would disclose that most of the patients who have heart attack, they can also have a brain stroke. So CT scan of brain is also recommended in patients with heart attack. Now, what are the most important risk factors associated with heart attack? The most important risk factors associated with heart attack are: first is tobacco smoking, drinking alcohol, high levels of LDL cholesterol in blood, high levels of glucose in blood in diabetes, and if there is uh, lack of exercise, physical activity, race, ethnicity like African American race, education. So these kinds of risk factors are associated with heart attacks. And it is believed that in high and middle income countries, heart attacks are the leading cause of death. There is a raised mortality and morbidity rates. Now, the risk stratification score, which is known as Framingham Risk Stratification Score, it is used to assess the risk factors in heart attack. Suppose if it is low risk and if the percentage is less than 10%, then it is low risk of heart attack. If it is 10 to 19%, it is moderate risk for heart attack. And if it is more than 20%, then it is high risk for heart attack. So if the risk factors are controlled, if they are modified risk factors, if lifestyle modification is encouraged, then patients can be prevented from heart attack. Now, talking about the complications of heart attack, what are the basic complications of heart attack? Patients of heart attack can have low cardiogenic shock, cardiac failure, aneurysm of left ventricle. There can be arrhythmias like ventricular fibrillation, ventricular tachycardia, atrial fibrillation. So these types of complications can be seen in patients with heart attack. Now, what are the risk factors for the complications of heart attack? Increased serum creatinine levels, increased troponin levels, peripheral vascular disease, diabetes, high blood pressure, severe hypertension. So these are the risk factors for complications of heart attack. So the complications can become adverse if the risk factors of complications of heart attack are not controlled at proper time. Now, talking about the differential diagnosis, the symptoms like chest pain and shortness of breath are not only seen in cardiogenic type of diseases, but it is also seen in respiratory diseases. For example, in COPD, chronic obstructive pulmonary disease, tuberculosis, bronchial asthma, pneumonia, rib fracture, costochondritis, tension pneumothorax. In these conditions, we can see uh, chest pain, shortness of breath, and these symptoms must be differentiated early on based on routine diagnostic investigations. Now, routine diagnostic investigation, we will first take physical examination of a patient. So, if you examine the patient thoroughly and if you examine the patient's heart thoroughly, then we can go on to ECG. In ECG, if there is criteria for heart attack or myocardial infarction, then we have to consider it. Suppose on ECG, if there is ST elevation, T wave changes, new bundle branch blocks, new Q wave formations. If these kinds of changes are seen, then we have to suppose that the patient has ST elevation type of heart attacks. Coming after ECG, we have to detect a clot or a thrombus formation within the coronary artery, and that is done with coronary angiography. So coronary angiography is also a diagnostic tool, and it is very essential tool to know the clot formation in the coronary artery. We have to also recommend the patients for chest x-rays to rule out any respiratory conditions or chronic illnesses which are associated with lungs. So we have to see the chest x-ray of the patient, and this is also recommended in patients of heart attack. If there are calcium deposits seen within the walls of the coronary arteries, that should also be detected, and it is detected using CT scans. CT scans are also very important in detecting calcium depositions. Radionuclide scans are also advanced type of investigation technique. For example, SPECT CT scans using thallium and fluorodeoxyglucose. These radionuclide scans are also helpful in determining the myocardial perfusion, how much blood is going to the heart, and based on that assessment, they will detect whether there is a damage to heart or not. Talking about the latest investigation, which is known as echocardiography, it can be stress echocardiography or Doppler echocardiography. Both are implemented in detecting motion wall abnormalities, defects in heart walls, and defects in motion of heart walls. So these types of defects is detected by echocardiography, and it is useful in diagnosing a heart attack. Now talking about the management of heart attack, how it is managed, that is very important. So aspirin 325 mg or ecosprin 325 mg are given in patients with heart attack because it is found to reduce mortality rates, and it is found to remove the blockage from the coronary artery. Beta blockers, which inhibit beta receptors in heart, they also decrease the mortality rates and prevent reinfarction of the heart. And beta blockers should not be given in patients who have cardiac arrest or cardiac failure. So that must be a precautionary measure to be taken while giving the management for heart attack. Statins should be supplemented because statins are used to control LDL cholesterol in blood, and that will decrease the atherosclerosis, and that will decrease the blockage within the coronary artery, and that will lead to prevention of heart attack. Heparin in unfractionated forms must also be given to prevent the enlargement of clot, and these blood thinners should be given after assessing the bleeding risk factor. ACE inhibitors, angiotensin converting enzyme inhibitors, are also given because they are found to decrease the fluid overload, and they will be managing the mortality rates in patients with heart attack. Aldosterone antagonist is also similar to ACE inhibitor. It is used to decrease the emergent hospitalizations and mortality rates, thereby preventing heart attacks. P2Y12 inhibitors such as clopidogrel, clopitab A 75 mg, ticagrelor, prasugrel like drugs must be given to control heart attacks. Tissue plasminogen activators, which are basically the component of fibrinolytic system, they are also used to control heart attacks. High supplemental oxygen must be given if patient is on low amount of oxygen. Morphine and nitroglycerin should be given to reduce the chest pain caused by heart attack. Percutaneous coronary intervention must be supplemented in patients with heart attack. So, what is percutaneous coronary intervention? Percutaneous coronary intervention is a technique where a probe is inserted via the radial artery or the femoral artery with a connected balloon, and the balloon is inflated and the clot is removed. So, PCI procedures should also be implemented as a part of emergency risk for heart attack. Now, coming to the prevention of heart attack, how we have to prevent heart attack. We have to go for lifestyle modifications. We have to control the risk factors. We have to modify the risk factors. We have to encourage rehabilitation programs. So, through these types of strategies, we can prevent heart attack. It is believed that 16.2 million people die every year, and that is 14% of deaths are occurring due to heart attack. Nowadays, the level of heart attack mortality rates have been increased in US. Now, exercise induced rehabilitation programs are encouraged, and they can prevent immediate hospitalizations and mortality rates. Doing regular physical exercise for 15 minutes can also prevent patient from having heart attack. 36% of smokers who smoke tobacco, it should be abandoned and they should be gone through de-addiction therapies so that heart attack cannot occur in these patients. Stopping alcohol through de-addiction procedures should also be adopted to prevent heart attacks. So, this is all about heart attack, how we have to cope up with heart attack, and how we have to understand the seriousness of this disease is well explained in this video, and you have to understand it. If there are any queries, medical queries available, you can contact me on phone number, on my phone number, which is a WhatsApp number. I take paid consultations, and that can be an audio consultation or a video consultation. And I would like to do this service for the welfare of society. Thanks for watching my channel. Please subscribe and share as much as possible. Thank you.